At CLA, we're not just in your corner. We're on it. We're advisors and advocates, planners and patients, consultants and cart returners. We coach third on Saturdays and businesses during the week. We're your neighbors, which means wherever you're coming from, we're right there with you. Wherever you're going, we'll get you there. CLA, CPAs, consultants, and wealth advisors.
Welcome to the Iowa Economy Podcast. I'm your host, Chris Conetzkey, president of BPC and publisher of the Business Record. The Iowa Economy Podcast is supported by our sponsors, CLA and the Iowa Lottery. And this is your place to get the economic insights you need to help you and your business stay ahead of Iowa's economic curve. And there's plenty of going on that always, of course, makes it hard to stay ahead. Today, though, we're going to take a little pause from some of the whiplash that we might see with the ongoing economic news. And we're going to pull back a little bit, pull back the doctor's curtain, if you will, and take a look at a longer term topic that is affecting and of course, will continue to affect Iowa's economy in the years ahead. We've got a special edition of Iowa Economy for you today. It's going to help us both prepare for an upcoming power breakfast on the economics of health here in the state, but more on that in a bit. And we're going to give you a bit of a window into some of the trends that are likely already affecting your business and perhaps will be continuing to affect your bottom line in the years ahead as well. With us today, we've got three fantastic guests, each who specialize a bit on economics of public health. And so we're going to deviate from our normal format just a bit. We're going to have each one come on, a trend or an issue affecting the economy. Then we'll bring them all back and spend a little bit of time picking their brains and learning more about the implications of health on the economy. So with us today, please welcome Andrea Harding. She's the Vice President of Population Health at Mercy One. Welcome, Andrea.
Thank you. Happy to be here.
We also have Jason Semprini. He's Assistant Professor at the Department with the Department of Public Health for Des Moines University Medicine and Health Sciences. Welcome, Jason.
Thanks for having me.
And lastly, we have Hari Sharma, Associate Professor for the University of Iowa Department of Health Management and Policy. Welcome, Hari.
Thank you for having me.
Well, thanks all three of you. We'll bring all three of you back in a moment, but that means right now, Andrea is going to be up first to start us off. So tell us just a quick little sign about your role and your area of focus, and then I'll have you give that one trend or health issue that's affecting Iowa's economy and the effect on Iowa's businesses.
Sure. Thank you so much. So I'm Andrea Harding. I'm the Vice President of Population Health here at Mercy One. We do cover the whole state of Iowa with our Mercy One footprint, representing our rural and urban patients and providers. The area that I cover is our ambulatory case management team. So we are care managers, health coaches that help people with chronic conditions. We also specialize in care gap closure, so ensuring that our patients are getting the necessary cancer screenings, medication adherence, and then finally do work with our payers across the state. So that might include our self-insured businesses, also some of the larger regional and national health payers that cover the Iowa footprint and allow us to partner with them to make sure that we're driving both a decrease in our total healthcare expense, which we know is an issue, but also higher quality across the board. So that's a little bit about my background.
Well, why don't you give us just a little bit of we'll give you a chance to give a trend or an issue that is affecting, from a health perspective, affecting Iowa's economy.
Sure. So one of the things that, I think is most prevalent that maybe some individuals don't understand is we actually see a fairly large disparity in our outcomes, both quality and the total cost of care between our urban and our rural populations. And that's really important to understand, not only from the provider side, so we can tailor the way that we deliver care, but when we think about the economy of Iowa, I think it's really important for our businesses, our employers to understand that. The employees that represent and serve our rural communities might have larger struggles getting access to healthcare. They have a lower just general adherence rate to getting their cancer screenings, to managing their chronic conditions, and they have a larger prevalence of some of those socioeconomic factors. So health insurance costs, premiums, they are a high hot topic for our businesses out there, and that all plays a role in it. And so making sure that we have the right programs at the provider level, but also in our communities to ensure the health and well-being of our employees and our communities is so important to ensuring the economic vitality of the state of Iowa.
You mentioned that difference between the urban and the disparity of outcomes. What are some of the factors that lead to that disparity of outcomes?
I think the biggest thing is probably the access to care. I think here at Mercy One do a great job of trying to be in our communities and provide that access point. But when you think about living in a rural community, your commute can sometimes be longer, right? So having that ability to go to the doctor right after work might be a bigger struggle, right? You might have a work shift where you work 12 hours, or you might work a off shift, second shift, third shift. That could be a factor. Also, just the general economics of living in a more rural community. We see a higher socioeconomic disparity. So having access from a financial perspective to medications is a huge concern. Having access to nutritious food, it really all compounds into the greater health and well-being of our communities.
I'm curious do you have any, and I'm putting you on the spot a little bit, but any reports or information that you'd be able to point folks to if they wanted to learn more about that? I hear what you're saying about the disparity in the outcome between urban and rural, and I think maybe what I lack a little bit is the framework for understanding what those outcomes look like in order to understand where it's actually creating a problem. So I'm curious if you could point me in a better direction, maybe on where we could learn more at.
Yeah, I think our statewide quality data, when you even look at a county presence, right, you're going to be able to see some trends from your statewide quality trends. I think as a business owner or I think working also with your insurer, right, that provides insurance for your employees, that's your starting point. Is really understand what they have. If you look at just for example, our Medicaid data across the state, you can see clear disparities between that. So partnering with your insurer is one option for it. If you leverage a broker or a larger or part of a larger collaborative, making sure that you're really assessing what are some of the health and wellness benefits that are available. I think is important, and how maybe some of that benefit design specifically helps in the management of our rural communities.
All right, last question for you, and then I think we'll move on to our next speaker. Is the pace at which that disparity between urban and rural, has that been increasing, staying the same? I know that we hear about population changes and transitions, and so just curious if you had any insight into what the pace of that disparity looks like.
I think it really depends on the lens that you're looking at it through, right? So we at Mercy One, we want to close that gap, right? Our regional trends across the state, to be transparent, I can't speak on that, but what we see that there is a gap, and our goal is as a provider to help close that gap and to partner with the businesses in our community, the nonprofits in our community agencies, and our payers as a whole to work towards closing it. So I think the goal and where we're all trying to get to is closing that gap over time.
Great. Thanks, Andrea. I appreciate you providing some insight into that disparity between urban and rural population. Next up, we're going to bring on Jason Semprini, who's Associate Professor, Department of Public Health at Des Moines University Medicine and Health Sciences. Jason, welcome.
Thanks for having me.
Jason, why don't you give just a little bit about your background and your role, and then we'll ask you the same question about a trend that you're watching.
Sounds good. So I'm a lifelong Iowan. I earned my PhD from the University of Iowa College of Public Health and spent a year doing cancer research at the Iowa Cancer Registry. Currently an assistant professor at Des Moines University. When I'm not teaching my students and supporting their professional development, I'm focusing my research on cancer prevention and control, which is really important for a state like Iowa. kind of my bread and butter research is evaluating how specific policies can improve or harm public health outcomes.
Great. Why don't you go ahead and give us a one trend or health issue that is affecting Iowa's economy and maybe what the effect is of that on Iowa businesses?
Absolutely. So I'll first start by sharing a rare public health win that we've had, at least as a country. So for the first time really in our nation's history, our cigarette smoking rate has fallen below 10%. For 70 years, this smoking rate has been falling, and we're finally now, right below 10% of our population, and we expect to see continued declines in the cigarette smoking rate. However, those negative trends have not been as strong. In fact, the trends have been pretty stagnant or flat in Iowa. We have higher smoking rates than the nation's average. And this is really important because we also have a high radon level. So smoking and radon, when those two coincide, the risks for adverse health outcomes are even worse. So smoking, even though it might seem like a problem that's been solved, it's still a problem here in Iowa. It causes 80 to 90% of lung cancers, 30% of all other cancers. It's the leading cause of preventable disease and mortality, including cardiovascular disease. Currently, we have about 450,000 smokers in the state. Now, you might be wondering, well, what's this got to do with our economy? Smoking is a health behavior, and it affects individuals and their health. And I'd like to push back on that thought just a little bit. So how this smoking trend, or lack thereof, the lack of improvements in Iowa, cigarette smoking affects our businesses in Iowa by driving up our health insurance premiums. They drive up also our healthcare costs, again, because they're contributing so much disease. There's a loss of productivity for people who maybe have to retire early or experience some type of disability. And finally, people who have to take time off work because of disease caused by cigarette smoking, re-entry is about 25% lower when it's caused by smoking. So those are important factors in a state facing kind of a workforce shortage as well.
Well, I probably have about a million questions I could ask you, but I'm going to start with one that's just, you said that our rate in Iowa for smoking is not below that 10%. Do you know what the number is off the top of your head?
It's about 14%.
14%. One of the things that, we've been, it's been a common vein. It's really been popping to the surface over the last, I'd say 5 or 6 months. And it came out at our Iowa economy, our economic forecast this year about cancer rates in the state and the effect on the economy. So that's part of the reason why we're doing the Power Breakfast as well, just to get a better understanding of health and what some of the downstream effects are. So I think you did a great job highlighting some of the reasons why businesses, of course, are need to be thinking about these things. The multiple factors that go into that, not just one thing. I think that's in your research on the cancer rate here. I think a lot of people are looking for that one thing. You just mentioned 2 or 3. So maybe if you could talk a little bit about how you think about it in your research, and just to help our audience understand that.
Yeah, I think there's never going to be just one thing because cancer is multifactorial, and it's, we don't want to lose sight of other diseases. Cardiovascular disease is the leading cause of mortality, and that's a big problem in Iowa too. So we don't want to, throw that out by focusing on one, hyper important problem. But when we look at smoking, it's one of the few factors that we know can prevent future incidence of cancers and other disease. So that would be an obvious part to start. And we can come at that from many angles. We don't have to just do one thing or focus only on, people who are on Medicaid or people who are of a certain age group. There's a lot that we could do as a system. And that's the type of research that I try to do.
And correct me if my statement ends up not being correct, but cancer almost feels like an end product of multiple unhealthy behaviors, the environment, treatment. It ends up being this thing. And right now, because of the cancer rates in Iowa, I believe the second highest rate of cancer in the nation, that is the stat that has popped free into the equation. But it's so complex, I think, the layers behind that. And so that complexity, maybe help us just a little bit understand how you try to peel back the layers of the complexity so that it's not summed up in one statement. A lot of people will say it's water quality, or it's this, it's drinking, and I think just helping with language for us could be helpful.
Yeah, there's just so much that we don't know, and people who would point to one thing maybe are trying to sell something else. But looking at it as a chronic disease that's built on a lifetime of different exposures, different genetic factors, different behavioral aspects, focusing farther upstream can have much harder hitting impacts for we don't just want to be cancer free, we want to be healthy. We want to be living and thriving with our families. Focusing on the actual causes that we know and can prevent really makes it much more simple.
But when you say 14% are still smoking, that seems surprising to me, and I don't know why that's in my mind. I'm just admitting out loud that feels higher than what I would guess, and that could just be by where I'm at in my circles and where I'm at. But I don't sense it as being as prevalent. But I think that ends up being the risk in the equation, is we think it's been something that's solved and maybe it has not been, right?
Absolutely. There's a lot more, social stigma, a lot of workplace or, indoor smoking restrictions. So we don't see it, but the people who still are smoking, they're finding ways. It's just, they're kind of more cast in the shadows. And that makes it harder for us in public health to support them to quit. Mm-hmm.
And 14% versus 10% doesn't feel like a lot, but that's a 40% increase in comparison to the rest of the nation. So if you're looking at factors, that's another one of those spots. So we'll have more from our guests in a moment, but we are able to bring great conversations like this to you because of the support of our sponsors. And this next segment right there with you is brought to you by CLA, a professional services firm with a rich wealth of knowledge and experience that we're tapping into in order to provide you with a hand on your shoulder and perhaps just a little bit of clarity in the midst of the economic haze. Right there with me today is Grant Rolfs, who specializes in assurance engagements for community banks as a principal of CLA. Grant, welcome.
Hey, Chris. Thanks for having me.
Assurance engagements, maybe folks don't necessarily know what that is. Tell us just a little bit about what you do in your role at CLA, and then we'll talk about what you're here for.
For sure. Yeah, big umbrella there with the assurance tag. So audits, consulting engagements, all of these can fall under the assurance umbrella. I'm fortunate enough to serve community banks throughout our state of Iowa and states surrounding the state of Iowa with the assurance and consulting engagements and maybe helping them through some questions they have in our current economic condition. Yeah.
Well, I know a key topic that we're always talking about, it's infused in almost every discussion that we have on this program. Yeah. And of course, when we're the community, is the role of technology and the impact on the economy, but also people's businesses. So, but that can also be a challenge. And many organizations say they need to modernize, but they're struggling with maybe where to begin at. So I just wonder maybe what's driving some of that uncertainty for folks as they're trying to adapt and be more digitally ready.
Yeah, well, you hit the nail on the head, right? What's step one? Every time we turn on the TV or open the newspaper, we see a lot of information there about AI and the transformation it's having, both on large and small institutions across the country. So the first piece of advice that I would offer is just to pause and stop and figure out what step one is. And sometimes that's finding a trusted advisor. Sometimes that's looking internally and finding that low-hanging fruit. So from a AI or digital perspective, that's probably where I'd start.
Why is it so critical for organizations to be continuing to advance in the digital space?
Yeah, so adapt or die, right? That's a common reference that we hear, and digital is having a transformative effect on business, whether that's process automation, chat bots, using that information to speed up research or review policy or contracts. There's so many use cases there, but it ultimately just comes down to efficiency. How can we find efficiency via these tools to make our organization better?
How does digital readiness maybe support more sustainable change in the organization?
Yeah, so one of the things we hear from a lot of institutions is succession. And that this kind of goes hand in hand. We're having a hard time maybe retaining some of that young talent So one of the things that we can do is identify process automation or efficiency in our day-to-day tasks and processes to maybe give those folks that are, typically tasked with those initial automation steps to actually find some more business processes that plugging them in for would make more sense too.
Well, and you mentioned, looking for that one step. What's maybe a way that you all play a role in helping organizations take on digital transformation?
Yeah, so at CLA, we have an array of services. So we have the opportunity, we can come in and step in as your chief artificial intelligence officer. That is an option. A lot of institutions aren't ready for that though. They're just looking for the first step. So we can sit down with you and form that path. What does step one look like? Based off step one, what do steps 2, 3, 4, and 5 look like? A lot of times that's standardizing our data. So we have the right data set to start to build those automation processes. So the answer is it depends, Chris. We'll meet you where you are.
Well, a chief CAIO sounds like something we could leverage ourselves. I was joking with you earlier. I'm heading to our AI committee meeting afterwards. So we really appreciate hearing that insight on how you can come alongside and help people. And thank you for your insight today. Anything else you'd like to share today?
No, Chris. It was a pleasure to join you.
Great. Well, thanks for joining us, for right there with you. And I'm glad CLA is going to be right there with us all year long. If you want to learn more from Grant and CLA, you can contact him in his email address on the screen, or you can find additional CLA resources at www.claconnect.com/resources. Well, Jason, I appreciate you providing a little bit of the understanding behind some of the factors that are leading into this and some of the effects then that's having. We're going to go ahead and bring on our next guest as well, Hari Sharma, Associate Professor with the University of Iowa Department of Health Management and Policy. Welcome, Hari.
Thank you for having me.
Well, Hari, why don't you go ahead and give just a little bit about yourself and what you do in your role, and then we'll have you answer the same question.
I'm Hari Sharma. I'm a health economist by training. I'm an associate professor here at University of Iowa, Department of Health Management and Policy. I do a lot of work around access, quality, and financing of care for older adults, especially focusing on post-acute care and long-term care services. So that's kind of my central focus.
Great. And why don't you go ahead and give us a trend that you're looking at and that's affecting Iowa's economy and perhaps what the effect is on Iowa businesses?
So I'm going to talk a little bit about a growing but often overlooked crisis that we have in our healthcare system, and that's the closure of nursing homes and hospitals across the country. And in Iowa in particular, that's becoming a growing concern. We've seen, a growing trend in nursing home closures, and in the nation, we had over 15,600 nursing homes before the pandemic, and now, it's gone down to 14,700 or so. If you think about Iowa alone, we've kind of lost 43 nursing homes since 2018. That's like 10% of nursing homes in Iowa. So we're kind of like absolute number of nursing homes has gone below 400 in Iowa now. And that has implications for not just access, but also the communities that are relying on these places for employment. And then, other providers of, supply chain issues as well. So that's kind of been a growing concern that I think is going to continue to impact our communities in the days ahead. A lot of the times people think of nursing homes and hospitals as being, healthcare access points, but they're also the centers for employment for a lot of people in our communities. When a nursing home closes, the health sector employment goes down in that community or that area by 3 to 4%. When a hospital closes, it's 10 to 14%. So they are, big employers of, individuals in these communities, and we should definitely, think about, how to control these, closures that are happening in a growing scale over time. And I expect this to continue, going forward. We got to be more proactive about how we can not just save access to or protect access to, post-acute care and long-term care services, but also protect employment and keep people here in Iowa. So that's kind of been like the focus for me. And that's something that I think is not being paid attention to a lot, but we should.
I hadn't recognized that. I know that we've talked about nursing home closures, but it kind of, maybe this is a simple question. If the nursing homes are closing, is it a demand question in those communities, or is it that the financial aspect doesn't work? Maybe that's both. I'm just curious what's leading to the closures in the nursing homes.
Yeah, it's a complex issue, right? So it's not just one factor, like we've talked about in this session, across different topics as well. There's a lot of factors, right? So it's both demand and supply issue as well. So for excuse me, for nursing homes, definitely low occupancy is a concern, right? So a lot of the places that are, closing are having low occupancies. But that's not necessarily always because of low demand for services. Sometimes it's also the workforce issue as well, right? So if you don't have workforce to support the bed capacity that you have, then you can't have people, right? So sometimes we're seeing places that have 50% occupancy, so they have those beds, but they don't have people that can actually provide services in the rest of the 50 beds. That they have that are lying empty, but they still need to pay for the building expenses. The fixed costs are still there. You still need a receptionist if you have 5 residents or 20 residents, right? So again, there are challenges on both ends in terms of demand, that we don't have enough people that want to be in a nursing home, or for that matter, other types of providers as well. Low reimbursement are a concern, right? So a lot of the times Medicaid payment rates are not enough for providers to cover cost of care, and sometimes with shortages, providers having to contract staff, that adds to cost as well, right? So not being able to retain local workforce is also another challenge that can contribute to this growing crisis.
Well, your comments circle right back to where Andrea started us off with, was the outcomes between urban and rural population. I imagine the access question, if you're delaying care because it's harder to get access to or it's not as convenient, I imagine that has higher implications later and more costly ultimately, which affects the premium question, right? So it becomes kind of a circle. Correct me if I'm wrong in my loose general assumption there.
No, that's exactly right. We go in circles around some of these issues. I've done quite a bit of work around what does a closure of a nursing home mean for a resident in a rural county, and when you think about our grandparents or parents that are about to enter that phase where they need assistance with their daily activities of living, and they can't live on their own, and they gotta go 25 miles away, that means I'm not gonna have time to visit them on a regular basis. And for older parents, they need that connection to have quality life, and we're finding that in rural, there are a lot more places that don't have anything within 25 miles of their home. So that means they're having to go to these places that are far away. They don't know a whole lot of people around that area. So I live in Iowa City. So for me, if I don't have anything nearby, that means I'm going to Cedar Rapids or beyond, right? So that's not a concern for major towns, because they almost always seem to have nursing homes or hospitals nearby. But for a lot of the rural counties, that is a concern. And we're finding that on a national scale, around 16% of, zip codes don't have anything within 25 miles in terms of nursing homes or, hospitals with swing beds or, home health agencies that can provide, let's say, post-acute care services. So that is a concern. And that's a concern that's a bigger concern for rural because of lack of places that can provide services. So and that can contribute to the disparities and outcomes that you're thinking of. In rural, we have, at least in the nursing home setting, depression rates are much higher in rural residents than in urban. And I'm not gonna say the factor is that they're far away from their families, but that could be one of the issues as well.
What was the term that you used?
Depression.
Depression. Sorry, I thought you said depreciation, and I was going, well, that's a different way to think about healthcare, but maybe. So yes, depression. Understood. Thanks for clarifying that one for me. We'll have more from our guests in a moment, but I'm excited today to be with CEO of the Iowa Lottery, Matt Strawn, for the next segment to talk about how the Iowa Lottery directly leverages its proceeds and impact for economic development across the state. Matt, welcome, and thanks for sponsoring the show.
Happy to, Chris. Always great to spend a little bit of time with you and your listeners.
Well, Matt, 93 cents per dollar that is spent on lottery product is redistributed back into the state's economy. Expand a little bit on that for our listeners to help them understand a little bit about where those dollars go to.
Yeah, thanks for asking that question, because I don't think a lot of Iowans fully appreciate that, again, 93 cents of every dollar spent on a lottery product stays in the state and is recirculated in the state's economy. 64 cents of that dollar is paid out in a prize that an Iowan has won by playing a lottery game. 22 cents of the dollar goes to those good causes that are supported by lottery revenues here in Iowa. 7 cents of that dollar stays right there in the pockets of any one of our 2,600 retailers that can be found in all of Iowa's 99 counties. So it truly is a win for Iowa's economy when Iowans play the lottery.
The lottery also, of course, then, as you mentioned, funds several things that help support the state. Maybe provide a little bit of overview of some of the way the proceeds go to different causes that you support.
Yeah, thank you for asking that question, Chris. About $100 million a year goes back to those good causes in the net income generated by lottery sales. The one that is most well known by Iowans is the Iowa Veterans Trust Fund. Iowa Lottery proceeds are the sole source of annual funding for the Iowa Veterans Trust Fund, which is a fund of last resort for Iowa veterans in need that can be accessed through any one of Iowa's 99 county veteran services offices. $2.5 million every year goes from the lottery to that fund. And the lottery proceeds also support things like survivors' insurance benefits for family members who have had a loved one die in the line of duty, whether a firefighter, a public safety officer, a corrections officer. And other than that, lottery proceeds go to the state's general fund. So when you think about those things that are funded by the legislature and the governor working together, education, agriculture, mental health, all those priorities are funded in part by lottery revenues and by lottery players responsibly playing the lottery.
When I jumped on today, you were talking about a story of somebody that had won the lottery, but how many people do win the lottery? I know there's lots of different games. I'm just curious about how that ultimately works.
Yeah, well, and you may have seen we've got the Winionaire campaign out there right now all across the state talking about anyone can define a win how they want to when it comes to playing the lottery. We talked earlier about a $500,000 winner we had from North Iowa that just walked in the office today, to you could win $5 on a scratch ticket that allows you to maybe add a little bit of guac to your lunch order when you're grabbing a burrito, to maybe you had a $20 win and you want to treat a friend to lunch later that day. So wins of all sizes happen at the Iowa Lottery. But the other thing, and that's partially why we're having this conversation with Iowans through your podcast, is those wins go beyond just that fun winning experience with a lottery ticket to those good causes that are supported with lottery revenues, to those retailers who sell lottery tickets and keep a little bit of that commission right there in their communities as well. So it truly is a win all around with the Iowa Lottery and Iowa's economy.
Well, thank you, Matt, and thanks for helping us learn a little bit more about the Iowa Lottery and the way that it impacts the economy. Why don't you go ahead and tell us who can win the lottery, just so that everybody knows?
All right, you got to be 21 and over, and you can't be like me and work for the lottery. I'm a prohibited player, but otherwise 21 and over, and just enjoy responsibly what is designed to be a fun, entertaining product that does some good right here at home.
All right. Thank you, Matt. And thank you again for helping sponsor the Iowa Economy Podcast.
Thanks, Chris.
I've got a follow-up question that I'll ask to all of you, but before we get to we'll do some kind of a round robin here of some other follow-up questions. I want to bring our editor, Sarah Dean, onto the screen. She's going to join us for the remainder of the program today. Sarah's the business record editor. She's going to be leading our Power Breakfast here in a couple of weeks, where we're going to be looking at some of the topics that have been raised today. I know this has been really helpful for me. Sarah, why don't you tell us just a little bit about the Power Breakfast and maybe a little bit about why we're taking an approach to talk about health as it relates to businesses here and the economy.
Yeah, this has been super interesting to listen in on, and as we prepare for this event that's coming up on May 14. So what we're really aiming to do is, look at this conversation displays just how multifaceted and oftentimes complex the healthcare system is. And so we want to, we know that we won't, in our hour or so event, that we won't be able to tackle everything, but we want to bring a conversation around that because there is a lot of attention and focus on several key issues in the healthcare sector. We've highlighted some here: cancer and other chronic diseases, as well as workforce and the longer term issues that come with the demands and implications for how we care for our communities and populations. So we want to think about how we're taking that collaborative and systematic approach that really keys into how does the state and the region as a whole approach these, where there's a lot of different perspectives and stakeholders involved. So I'm really appreciative of our guests today and looking forward to our Power Breakfast on May 14. We'd love to have you join us. You can register for that at businessrecord.com/events if you're able to come.
Well, thanks, Sarah. And Sarah will have an opportunity to ask a question or here too as well. But where I wanted to start, just as something that what maybe happens to me as I learn more about it is it can become almost easy to get overwhelmed because you go, oh my gosh, there's just so many different things that need to be affected in order to improve our health outcomes. And maybe even within that fog, it can be hard to understand that there has to be a big drag ultimately on things like productivity when we're just putting it through a dollars and cents standpoint and business operation. I'm just curious if any of you have a perspective on how we might think about the effects from a quantitative standpoint, and if there are maybe some data sets out there that people have looked at to talk about the implication. I'm trying to learn if there's something out there already, or if that's an area that we could be more fine about.
People keep asking about how we could quantify the financial impact of a cancer diagnosis. And really there's no data set out there that could do that. And we could, make some assumptions, but it's not just the cost of care for that cancer. It's the cost of loss of productivity. It's going to be the cost, non-financial, like psychosocial detriment, even if people survive. And then years of lost life, we can quantify that. In a business or economic sense, but it gets really complicated really fast. And I recognize why people want to know that, but the effort itself seems quite substantial.
And I think that's part of the challenge. I think that it almost becomes a moving target in terms of, or not a single target, even within individual discussions around cancers, or if you go even more micro into very specific cancers, it just really does kind of mushroom cloud, which makes me go, man, that's a big glacier of effect, but it's hard to actually quantify what the effect would actually be.
Mm-hmm.
Yeah, I would jump in here and just say that I think that it's been a challenge in recent years to quantify that. I would say about 10 years ago, there was a really large push with larger employers, particularly self-insured, to really invest in wellness programs. And because there was data out there that said if you invested in wellness programs like smoking cessation, weight loss, pre-diabetes programs, that would slow down the total cost of care trajectory for your employee population over time. I believe that that is accurate still. Where I think we now have a challenge is quantifying that is that we see that a lot of businesses are no longer sticking with the same insurer year over year. And really for those programs to really demonstrate the ROI and for us to have the good data behind it, so the total cost of care data, the quality outcomes data, along with that productivity data, right, that says, hey, this is how many sick call-ins I had for this age group of population over time. You have to have some stability in your population. And with rising healthcare costs, insurance premiums going up, and us all wanting to keep that as low as cost as possible for our employees, or because as an employer, we struggle to cover more of that, right? It ends up being a viability issue for us as an employer to be able to cover as much. And now we have to do some cost sharing with our employees. We want to maybe shift our plan. We shift it to a different insurer out there. And so some of that data is lost. And being able to monitor that longitudinally. So I would say that I think that in recent years, we've actually kind of gone backwards in the true measurement of it. But there are studies out there that really show the investment in health and wellness programs and the prevention of certain diseases and the impact on your employee population.
I was just going to push back on that because while it's hard to quantify the impact of a disease, it is relatively easier, still challenging, to quantify the impact of a policy or an intervention. And this is where science becomes very difficult because we'll have a lot of peer-reviewed literature showing completely opposite things. And there's been important recent work from Hari and I's alma mater, the University of Chicago, where they actually ran randomized controlled trials at businesses evaluating the impact of a wellness program, and unfortunately found that they didn't actually result in lower costs. Now, that's not to say they don't work for certain groups or in certain settings, but really becomes challenging when something that sounds good, sounds like it will have a big impact, doesn't actually translate to that on a large scale.
I don't disagree with you on that. I've seen that research as well. I think where you really get the impact is you have to do it for a substantial period of time. So I spent about 10 years of my career in Pennsylvania. I serviced a rural and urban population. We were with a provider that also had a health plan. Very stable population. So we demonstrated the impact of smoking cessation, weight loss programs, things like that. But again, as that population churns, it's much harder to measure moving forward. So I think both things are true.
I just want to add one more thing. I think we're all trying to think about workforce and how to make sure that workers are being productive. And, if you're not addressing the underlying issues that are, bothering people, then you're not fixing it with just one or two things at workplace. Someone might have a child at home that they need to take care of, but they don't have the ability to take time off to take care of the child, or we don't have, policies that address childcare issues, or having to take care of your parents that need help. But a lot of the care for parents goes unpaid. And so how do you manage your time between work and taking care of your parents and still remain productive that employers expect? It's a harder challenge, and that kind of leads to, burnout of these workers, and they're stressed out. And when you're stressed out, you're not going to be productive, and you're not going to have that relationship that you're going to have with your coworkers that you think you should have. And we recently did a survey of, direct care workers in Iowa, working in all sorts of settings. And, one of the things that we found was a lot of them are not getting paid sick leaves. And that adds to burnout of workers. And then you see these high turnover of workforce in healthcare setting. That's not productive. That's not being productive. You lose one worker, it takes a ton to replace that worker. And employers are having to pay for that additional cost of hiring another worker, training, and then it takes a few months for them to get, up to speed. So, we gotta fix the workforce crisis if we are to address, productivity challenges. And for that, we got to put workers front and center and think about how you can support them to support the mission of the organization, whether it's in healthcare or other settings.
It's the worker productivity component of things. That's something that's been popping up over the last 2 or 3 years, especially coming out of COVID, that there was a lot. I haven't looked at it more closely recently, but I know there were a lot of questions going, well, why, with technological advances, all the things that are happening, why wouldn't there be greater productivity ultimately coming from our workforces? And I wonder if maybe health might end up being one of those drags that is harder to quantify, but is maybe pulling down overall productivity. When you just mentioned the number of things that you just described that people are navigating, and if that's happening at maybe a greater rate today, that could be a big part of that.
I mean, I would just jump in here to say we could probably have a whole podcast on multi-generational workforce and the complexities on health and economics for it. And I would echo all of those sentiments that, especially as we see the workforce change and that multi-generation, more of that, what they call that sandwich generation, they're caring for kids, they're caring for adults. I think that all impacts your productivity. You're carrying a mental load that cannot be quantified. And it's been very interesting. I've seen, having spent some time in a different organization prior to joining Mercy One, I can't tell you how many frontline staff individuals, so an MA, right, or nurses, core people to the functions of our clinics, wanted to decrease their FTE to part-time because they either couldn't afford their childcare, or they were a 50-year-old individual who has a grandchild who is going to help out their daughter by caring for them 1 or 2 days a week so that they could work. And so now you're left with multiple part-time positions. You want to retain those individuals, because recruiting MAs, recruiting nurses to a rural area is hard enough. You don't want to lose that great workforce, but now you have a model that doesn't really support the business operations, and we have to pivot. And so all of that compounds into the productivity of the system. And so I think I would challenge our businesses out there to think about, how can we think about our workforce differently? How can we think about how we deliver our work differently? We challenge that here at Mercy One. What are ways that we can take nurses that maybe, reaching the point where they physically can't do the job, but they have a great nursing ability to do? Could they be in a telephonic triage role that works from home and works better with their work-life balance, and supports their health and well-being? Worked in organizations where we're doing virtual admissions to the hospital, right? Somebody who can't lift patients anymore, but they could sit in a command center and do a video admission to the hospital. So I think we really have to think about how we challenge the way that we deliver our business and meet our multi-generational workforce where they're at.
I'm going to let Sarah ask a question here, and then we'll get ready to kind of wrap ourselves up. Before she does, Jason, that University of Chicago paper, that sounds like maybe you're a Freakonomics fan or not, but that sounds like it's ripe for a Freakonomics episode, and maybe they've already done it. So
yeah, I'll check that out.
Are you by chance a fan of that show?
I am, absolutely. Although they've been starting to get debunked a bit.
They did a. Oh, really? Okay, so we have to look at that one as well, huh? Well, good. Sarah, why don't you go ahead and ask a question?
Yeah, I kind of want to take the multi-generational workforce question a little bit. And Hari, when you were talking, I want to take that in a little bit of a different direction, because when you were talking about closures of nursing homes and hospitals, I think often in Iowa, the conversation is about, a smaller population and a larger aging population. So, the fact that there are nursing home closures is making me think about, long-term, what are the implications of that? I'm not sure where we're at in terms of, what proportion. I think maybe I saw something about the first baby boomers turning 80, I believe it was. So just depending on where we are in that kind of aging of that generation, what the kind of economic landscape with workforce challenges and challenges with, maybe having some of these facilities open, what that looks like down the road as that generation continues to age. And like Andrea was talking, we have workforce challenges and needs in the younger generations.
Yeah, thank you. That's a great question. And, we will see more nursing homes closing. We'll see hospitals closing. That's going to happen. We can't stop it. But what we can do is kind of come up with ways to address the access challenges in ways that are feasible in rural communities, right? So, we can't sustain a 50-bed nursing home in a county that doesn't have, 10,000 people, let's say. But we can have a nursing home that has 15 beds, but then the lower floor of that nursing home is a daycare center. So we got to be a little bit more creative about how we utilize these spaces that we have, so that we can pay for the fixed costs that we have, make sure our local workforce is staying, right? So that's very important. And that we're paying them enough so that they don't have to work 2 part-time jobs. I think that's very, very important. But if we start paying them less, if we start not taking care of their needs, then we're not going to have sustainable workforce in Iowa. And the other thing that I think is critical when it comes to workforce that cares for older individuals is the immigrant population. We absolutely need that population, immigrant workforce, to take care of individuals. There are many states that have, over 15-20% of the workforce that's immigrant workforce. And just stopping right at this moment is not going to help us with the crisis, right? So, we cannot continue to have the benefits that we are offering, the treatment that we are offering to these workforce, and hope that they're going to stay in this space where they're providing long-term care services. We certainly need to bring in more people, but also work to retain this workforce. And to retain that workforce, just paying them $2 more is not going to be sufficient. They need some additional incentives to stay. Do they need growth opportunities? Do they need flexibilities with respect to their time, right? So if you're going to tell someone with a 5-year-old kid at home that, hey, their shift changed and now they're going to work, 3 to 7, that's not going to work for them, right? So we got to make sure that the things that are going to stress these workers are not there, and we can be flexible about how we approach their time and their needs with what we need as a community in terms of providing these services. So, we got to touch on all of those things, and just focusing on one is not going to be sufficient.
Thanks so much, Hari. I think we are just about at our time, so I want to give you each a chance to give kind of a closing thought. And it might be a good opportunity if there's something that you wish businesses would consider as they're thinking about the implications of health on the economy. So, Andrea, we started with you. We'll have you go ahead and start off again for this.
Yeah, I think it's important to think about how, as an employer, right, you can partner with your local providers in your communities, whether that be a Mercy One or another provider across the state of Iowa. I think from whether it be in employee health perspective, health and wellness, whether it be on the insurer side, I think there's ways that we can partner better, right, across industries to make sure that at the end of the day, we're improving the health of our communities. And so when you're not in the healthcare business, it might not be top of mind, but I think that there's immense opportunities to look at that collaboration, whether it be from a workforce partnership. And I would challenge our businesses to keep an open mind and maybe talk to your local healthcare agency about those opportunities.
All right, Hari, I got you up next, and then Jason will have you close us out.
I just want to say again, I think we'll continue to see more providers closing, and that's going to happen, and it's going to have huge implications for the communities because they're going to lose jobs and they're also going to lose access to services. So, we just need to be a little bit more creative about how we can sustain these facilities, maybe not in the same form that they are currently, but in different forms, so that we can continue to have access to the services that we need. While also making sure that we also have the jobs that we need in the communities. Thank you.
No, thank you, Hari. And Jason, go ahead and wrap us up.
Absolutely. Thank you again for having me. So in 10 years, Iowa is projected to have the #1 smoking rate in the country. That is not going to go well for a state that already has a high incidence of cancer. Getting below this 5% metric to be technically considered smoke-free is going to require more novel and innovative solutions. We can't rely on what maybe worked to get us to 20 and 15% in the past. There's a reason that people are still smoking despite the social stigma and the education and awareness of the harms. And businesses can really play an integral role in being part of a community and a system that's striving for that smoke-free Iowa. Thank you.
Thank you, Jason, and thank you to each of you for giving us a little bit of insight. This is such a big topic. These are just some of the topics that we know are affecting ultimately the economy and your business. So I appreciate each of you giving us some threads that we can go continue to unpack, not just at our Power Breakfast and not just today, but also as we continue to report about some of the implications. Maybe my takeaway for today is that the collective way that this is affecting productivity and ultimately then your business, it's a little bit hard and murky to see. We know it's happening, we know it's there, and it can seem hard to know exactly what to do about it. But I think one of the best ways that we can take steps towards that is understanding what the root causes are and understanding what some of the root effects ultimately are as well. So, and I think our group today did a great job of helping provide some of those threads for us to go to continue to unpack in the future. So a big thank you to our guests for helping us make a little bit more sense, both of the economy and of course the healthcare landscape, and of course to our sponsors, CLA and Iowa Lottery. We can't put on programming like this without the support of our sponsors. So I hope you take a moment to learn a little bit more about both CLA and the Iowa Lottery. If you enjoyed today's show, please like and subscribe and tell your colleagues. I firmly believe we're stronger as a community when more people have better information so they can make better decisions. That's what makes your business better and your community stronger. Thank you for watching. Until next time, stay healthy and keep your eyes up and peering ahead of Iowa's economic curve.